Hi, good morning to our lecturer Dr. Habib. I am Rashidhan Dababare. Today, I would like to introduce about what we have done in our new media analysis assignment. We have chosen a topic named Kementerian Kesihatan Malaysia. So, the public health communications plays a very important role in shaping the people's awareness and behaviors and health and well-being. In this today era digital, where the information has been spread rapidly through the online platforms, social medias effectively, and timely health communications is very more important than ever. In this country, Malaysia, the Ministry of Health, Kementerian Kesihatan Malaysia (KKM) is the main authority which is very responsible for protecting the public health, and its roles are include providing healthcare services, developing the national health policies, and so on. So, to achieve this goal at KKM, this relies heavily on strategic communication to ensure that health information is very accurate, easily understood, and is accessible to all segments of the society. So, this report focuses on the KKM's public health communication strategies, and particularly in addressing the non-communicable diseases such as COVID-19, dengue fever, cardiovascular disease, and also even cancer. So, overall, this study helped us to understand how effective these media strategies support public health goals, and also recommend us to strengthening the future health communication efforts in Asia.
Have you ever wondered how health information from the KKM reaches you so quickly? KKM uses a mix of media tools to ensure that information is fast, accessible, and accurate. Platforms like Instagram, Facebook, and X allow KKM to share infographics, urgent updates, and short videos in real time. Secondly, official websites. Now this is where KKM posts real-time updates and press statements are published. Thirdly, media statements. These press releases are then picked up by television and newspapers. For example, during a COVID-19 crisis, this is where the citizens of Malaysia keep updated on the cases. And finally, traditional mass media, like this program, Hello Doctor, ensures that the public still gets information even if they are not active online. These media tools are generally accessible, but access depends on location, connectivity, and age group. Urban audiences benefit more from social media and websites, while rural communities and older generations often rely on television, radio, and printed material. Printed media, like brochures and posters, remain essential and are commonly found in clinic kesihatan, community events, and public spaces. By combining digital, traditional, and community-based media, KKM ensures that public health information is accessible for all. Because when it comes to health, accessibility matters.
Hello, my name is Kojayet. Today I will talk about the Ministry of Health or MOH use different type of media, and each medium has its strengths and weaknesses. Firstly, social media allow MOH to deliver health information and pandemic warning and new policies quickly. It helps MOH reach a wide audience, especially young people, and it enables interactions that build public trust. However, social media also allow false information to spread easily. Short messages might be misunderstood, and MOH might face cyber criticism or reduced react due to algorithm charge and limited internet access. Secondly, the official MOH website is an authoritative and reliable source of information. It provides detailed official materials such as SOP, policies, and reports that support long-term health education. However, the website is less accessible, mostly one-way in communication, slower to update, and less attractive to younger users. Thirdly, traditional mass media like television and radio effectively reach elderly people. Health program help explain information clearly. However, traditional media is costly, offer in limited interaction and limited airline, and is less effective in reaching younger audience. Finally, media statements ensure accurate and consistent information, especially during health crises. However, they depend on media outlet, might cause delay, and can result in unbalanced coverage. Thank you so much.
Now, we will explain how Kementerian Kesihatan Malaysia or KKM use different media platform to reach different audience and how wide their media coverage are. First, let's look at the audience characteristic. KKM use social media like Instagram, TikTok, Facebook, and X to reach younger and tech-savvy audience. These platforms are effective because information is shared through short videos, infographic, and simple visuals. This makes it easier for young adult and urban communities to understand and share health information. For audience who need more detailed and official information, KKM use official website and media statement. These are more suitable for healthcare workers, journalists, and publics who want accurate and reliable guidelines. In terms of media coverage, traditional media such as television and radio help KKM reach older adults and rural communities, especially those with limited internet access. By combining digital media, mainstream news, and traditional media, KKM ensures public health information reaches people of all ages and backgrounds across Malaysia.
Dan severe acute respiratory infections menunjukkan kadar konsultasi meningkat daripada 7.
When it comes to healthy information, timing is just important. It's critical. The Ministry of Healthy Malaysia or KKM understand that healthy updates affect public safety. That's why timeless is a key priority in their communication. KKM use both digital and traditional media, but the digital platform lead the way through official website and official media like Facebook, Instagram, X, and TikTok. Information can be shared in real time for healthy alert to privacy change. For the example, during the COVID-19 pandemic, KKM provide daily updates on case number, vaccination, and SOP through live briefing and online platform. This can help the public respond quickly and accurately. Lastly, while traditional media still plays a supporting role, digital media ensure speed, accuracy, and trust. Because in public health, getting the right information at the right time can save life.
Firstly, media platforms such as the Ministry of Health e-bulletin encourage positive behavior change among the public. Articles about healthy lifestyle help people understand the importance of regular exercise and a balanced diet. Secondly, media increases public health awareness. When health information is shared consistently, the message reaches a wider audience, making the public more aware of health risks and preventive actions. Thirdly, media improve understanding of health information. Visual elements such as videos, infographics, and image make complicated health topics easy to understand and reduce confusion. Fourthly, media builds trust in official health information. When information is delivered by a credible source such as the Ministry of Health, the public has more confidence in making health-related decisions. Lastly, audio media supports continuous health education. Through recorded health messages, the public can learn about various health topics for more easily and in greater depth.
Okay, let's move on to the last part of this video presentation. Okay, to conclude, the Ministry of Health of Malaysia, which is known as Kementerian Kesihatan Malaysia, plays a very significant role in protecting the public health through the effective use of various media platforms to deliver the health information. So, this report has discussed on how the KKM use for both digital and traditional media to communicate the public health messages, especially on the non-communicable diseases such as dengue fever, COVID-19. So, these discussions shows that the effective health communications is essential in increasing the public awareness and also shaping the positive health attitudes and encouraging the behavior among the nations. So, the KKM multi-platform communication approaches us to allow the health information to reach different groups of people based on their media preference and access to this technology. So, although each media of the platform has its strengths and weakness, combining them helps this KKM to balance their limitation. So, by tailoring their messages to suit the differences of the audience categories, the KKM ensures that health information is clear, access and easily understood level of society. So, the KKM is very much important to all of us and is to ensure that we all will stay happily in this environment. That's all from me. Thank you.